Hi, welcome to the fourth episode of my podcast. Today I'm talking with my mentor and a good friend from East High School about stigmas and stereotypes that are often pushed in abstinence only education. So I hope you enjoy. Thank you so much for watching.
Okay, my name is Erin McIntyre. I'm a senior at the same school as Matilda, and we know each other through friend groups.
I'm Sunny Courier, and I am a sexuality education teacher. And I have been teaching sex ed in different settings for probably 20 years.
So today I kind of wanted to talk about how a lot of stigmas are projected onto students through abstinence-only education and how it's really damaging to their sexual and emotional health, just overall, because a lot of these stigmas, I mean, obviously they're not true, but I think a lot of these stem from the idea that sex is really taboo for a lot of people. Just talking about it isn't really it's not something people openly discuss all the time, especially in a school setting. And I think the issue that lies is parents assume that kids are being taught sex ed in school, and then the schools think that the parents are talking to their kids about it. So there's like this weird imbalance in information that's presented. But I know OWL has been really helpful for a lot of kids with that, just by kind of acknowledging the biases and kind of providing factual information rather than just assumptions. But I guess I know one of the first big things that I remember in abstinence only is like talking about birth control and how it's not effective at all, and people who use it must only be using it for sex. I know personally I was on birth control in elementary school because I had really bad cystic acne, and it was like I was really kind of ashamed of it for a long time because I didn't want people to think I was already doing things as a fifth grader that the average fifth grader wouldn't be doing. And it was really kind of scary. But I mean, in reality, people do it for all sorts of things like regulating periods and migraines, endometriosis, and acne, just like me. But I mean, I don't know, Sunny, what do you have to say about that?
The stigma is definitely there. And in terms of students seeking out birth control for sexual activity, it feels like the stigma is so great that it makes it less likely that they will try and get birth control. I think it also makes it less likely that if they are sexually active, makes it less likely that they would seek any kind of help, STI testing, to stay things for their sexual health.
Yeah. I mean, I know friends who are like horrified to talk to their parents about wanting to go on some sort of birth control because they don't want their parents to assume the worst, or like to lose their parents' trust almost because they're asking for birth control. And maybe that's not the full reason that they're asking for it. There's about a dozen other things that people use birth control for other than birth control.
Right.
But and I think another way is when abstinence, I know, like when I went through the school sex ed and we had the clarity teacher come in, I think actually this was my elementary school, we also had someone come in and talk about from clarity. It was this idea that sex is like a fire in a fireplace, and like if you get too close to the flame, you'll get hurt and you're burned and you're scarred forever. And like the idea that once you've had sex, you're permanently stained, and like you'll never be I guess the old good word would be pure. I think it's so damaging, and honestly it's so gross to think about that there are adults telling kids these things, that like, oh, once you've done this, you're never good, like you're a terrible person. Like, Erin, did you ever have to sign like the clarity pledge? Did you go through sex ed in like 9th or 10th grade?
Yeah, mine was a little different though, because as you know, when I was in elementary school, I went to a parochial school. And so sex ed wasn't even a thing. It was just like, if you're even thinking about having sex or your siblings are having sex, just know that they're sinners and there's no redemption for them or whatever. And then when I went to middle school, it was a public school. And then we had the woman from Clarity come in, and she was talking about sexual assault and how it wasn't anybody's fault. And that's really when I first started learning about it, but she definitely didn't give enough information for me to be like comfortable if I ever wanted to think about like reaching out for help about sex ed.
Yeah. I know, like when I was researching for my senior paper, it was about like how ineffective abstinence only education is. And there were schools in I think especially in the South, they were having these activities in their sex ed classes where they would pass around toothbrushes, and then they'd say, okay, pass the toothbrush that you just used to another person and ask them if they'd want to use that. And then obviously all the kids were like, oh, no, I don't want to use your toothbrush. And then the teachers would compare those used items to people who have had sex before, saying no one would want you if you've had sex before you're married. And I think it just proposes this overarching idea that sex before marriage makes people worthless and unwanted. And very specifically, I remember there was a student in Georgia. She told the Atlanta Journal Constitution that her teacher for sex ed told her that no one wants a flower with no petals, meaning like once you've had sex, people ruin you. And I think it's just so awful. It's just not true. And I mean, even with people, I know Clarity, our experience was a little bit better than what some students have in other places, but it just, this whole idea totally takes away from people who have been a victim of sexual assault and their trauma. Like it almost puts the blame on them, which is just very damaging.
Yeah, I can't imagine like being in elementary school and not necessarily knowing like even what sex is or how to form sexual relationships, and then knowing that you were somehow abused in a sexual manner, and then being told that you're kind of worthless or gross for something that wasn't your fault at all, that you didn't even completely understand.
Yeah.
Sexual assault is not that uncommon. My pretty educated guess would be that in any sixth grade classroom, sixth grade or older, there's going to be at least one person who's been a victim of some sort of sexual assault or molestation. So you are telling them that they're never going to be the same again. Victims also, I believe, are less likely to report an assault if they feel shame or stigma associated with that. What that means is that could affect their sexual health if they don't report it. And that also leaves a perpetrator to go free and assault again.
Yeah, really. And there's also this, I think it's just pushed this idea that like, it's really, I think it's more the importance of all these things. Like they push these harmful stereotypes with genders. Like I think almost it gives the females the responsibility for male sexuality. Like even beyond abstinence only education, I know friends complain about the dress code for schools all the time. Like girls, you can't wear tank tops, you can't wear any of these things. Obviously there's a line to be drawn with like what's appropriate at school for anybody, but there's a very clear imbalance of like what's expected out of a girl for her to dress in school and how it is for a boy. And I think abstinence only just kind of advocates for that. Like, yeah, if you're a girl, you're the one who's responsible for if you get pregnant, you're the one responsible for if you're assaulted. And it's just all so bad. It's just awful.
It's terrible.
Yeah.
It also doesn't hold anybody accountable for their behaviors except for women, really.
Yeah.
Thinking back through my entire high school experience, like in a social standpoint, it was always the boys could act however they wanted. If they were flirting with every girl, oh, they're just a player, they're cool, they're just popular. But if a girl started flirting with everybody, immediately they're getting called names, they're devalued. It makes they're like a lot of the people at the like social setting would assume that the girl is therefore like tainted or she's undateable because she's gone around and flirted with everybody. But like if a boy does that, like automatically he's some kind of prize. I don't get how
it's
double standard there.
Yeah, and like kind of, I know this is going back to just talking about birth control and everything, but I think it's also talking about just STIs in general. Like girls often, I know for girls it's a lot more shameful maybe, or it's a lot more daunting for girls to come forward and be like talking to their partners if if they have contracted an STI, and maybe it's not even, it's from their partner, or it's from it's just something that's been an underlying condition that hasn't shown symptoms for a while. There's just the idea that once you get an STI, it's like a death sentence, which is really not the case. And it's terrible how AB-only doesn't really provide any information on like resources where kids can go for treatment or even diagnosis, because I mean, some of these conditions I talked about in my last episode, they have really permanent side effects like infertility, and I mean even like neurological disorders. I know in OWL there's you told us about the brown bag where yeah. I remember telling people, so actually you go ahead and talk about the brown bag really quick if that's okay.
Sure. I think it's pretty clear some teenagers are embarrassed and ashamed to even try to obtain some kind of protection for birth control or for STI purposes. Not everybody feels comfortable walking into Walmart or Target and walking out with condoms while their mom is in the grocery area. So one of the things that we know is that the Bartholomew County Health Department, which is located just off 25th Street in the Fox Point area, gives out free condoms. And they have what they call a brown bag that contains condoms. It contains instructions on how to use the condom. It sometimes includes a dental dam. It includes lube and some other things that people might find useful. And they've made a point to say that people can walk into their office and say, may I please have a brown bag? That's all they have to say. And they're handed a brown bag with, I don't know, a bunch of good condoms and other things in it for no charge. And you don't have to say the word condom if you're uncomfortable with that. And that gives you, if used correctly, condoms give you very, very good protection against STIs. They don't give you 100% protection, but they give you easily, if they're used correctly, probably 98, 99%.
Yeah. And I've told people about people I know about that resource, and they're just kind of like, what? Like, there's no way. Like, I never would have known about that. And there were people who are like, oh man, I wish I knew about that, because it is so embarrassing to go in and pick out a box of condoms and walk out wondering, oh my gosh, who's gonna see me? Well, I'm at Target. Is that my mom? Is that my mom's friend? Is she gonna tell my mom?
Right.
which, I mean, that's another topic, but I mean, just in general, STIs are not a death sentence in any way. Most of them, a lot of them are just treated with a simple antibiotic or prescribed medication for like, I mean, I don't know the specifics, but probably like a month at the most of antibiotics, just a quick round, and just being open and talking to your healthcare provider, your doctor. That's a great source to talk to about those things. And not being scared to get help, because most of the services provided are anonymous, pretty much all of them, and they're at free or reduced cost depending on your insurance provider. I kind of talked about with Dr. Hartwell about the anonymous factor with insurance in the last episode, so if there's any interest in that, go back and rewatch that maybe. But yeah, for the most part, free or reduced cost, and no one judges you there. Like, no one would be like, you're a horrible person for coming to our clinic. That's just not the case ever. But I don't know. I know there's 2 Clarity clinics in Columbus, and then there's 1 Planned Parenthood.
Yes.
I'm pretty sure. Yeah. But yeah.
And the health department as well.
And the health department. I always forget about that. I always forget that we have that in Columbus. But moving on, I guess I remember very specifically going through 9th grade. I guess a lot of these things that I've noticed when I went through sex ed in 9th grade is because I went through OWL. I just kind of realized as we were going through, we didn't really talk about any other identity besides being a heterosexual cis person. And it just kind of erased the LGBTQ community. It kind of only affirms that the correct pretense for sex has to be a married heterosexual couple. And I mean, it doesn't provide any sort of information about sex ed or resources that could be useful to people who are not in heterosexual relationships, or even any sort of like mental health resources for those kind of things. Because I think being a student growing up as a person who may not identify as someone, as the norm, not the norm, as the majority, it's really daunting to come forward and look for resources. And it's kind of like, I guess with the internet, it's gotten a lot better, but it's still like, you don't really no one talks about it in sex ed for at the moment, unless you're going through a more comprehensive course. But I don't know, Erin, what do you think?
I think especially with the only teaching heterosexual norms, I think it leaves a lot of people who are in the LGBT community to not even know if they're sexually active, because there's not really a vocabulary that has been defined for them. Like in sex ed for heterosexual people, it's defined as you lose your virginity when penis and vagina. But like if you're in a same gender relationship, how are you supposed to know exactly where that line draws between if you're a virgin anymore, if you should be getting further resources, what protection you should be using, if a condom even works for you anymore?
Yeah.
There's just a ton of gray area when things aren't defined.
Yeah.
And virginity is almost something that, again, centers on the female sexual activity. You don't hear that as much, I don't think, about males. You're absolutely right that it's very heterocentric, which marginalizes a whole community of people. I'm hearing a lot of talk about virginity from middle schoolers recently. I'm hearing a lot of language about your V card, which really distresses me, because that seems to bring your virginity down to a commodity.
Yeah.
And of course, it's female virginity that becomes a commodity. It becomes a card you play, a way you become, it defines your value. And that's something to think about as well. But definitely the LGBTQ community becomes marginalized when that isn't discussed. If two people with vaginas are having oral sex, who tells you how to protect yourself without a condom for a penis, right?
Yeah.
And that's, you need to know those things for your sexual health.
Yeah, it's a humongous, I mean, it's like, I'm like a broken record right now. It's just the huge lack of information, and it's putting America's youth in danger of not having the right resources and not being able to manage and protect their sexual health in a way that so that they can have a healthy life in the future. Because it's like I said earlier, you can have an STI and it can have virtually no symptoms, and you can find out years later that there's something worse, or that it's progressed to be something worse. Again, not a death sentence, but it's important to get help as soon as possible and when you can, to help treat those infections. But also, I think the transition from the word disease, STDs, to STIs has kind of made it a little bit of a
normalcy.
Yeah, less scary, because it's like, oh my gosh, disease, like I'm done for.
When you think about it, going to get an STI treated really is like comparing it to the common cold. You go to the doctor, you have a common cold, you take care of it with a couple antibiotics for a couple days, and you're fine. It goes away, your body builds immunities to it. But if you let it fester, your cold could develop into pneumonia or something and become way more serious that you're going to have to go to the hospital or the ER for. And I mean, the same thing can be said for STIs, but it shouldn't be as scary as going to your doctor for something as common as the flu.
Exactly. And I mean, you don't necessarily, STIs come about in more ways than just sex.
Yeah.
And like it can come from just
poor hygiene.
Yeah, or even just like not necessarily intercourse, but just like touching and skin to skin contact, fluids of any sort. And even, I mean, STIs can be passed from mother to fetus in some regard. I'm not sure exactly which ones, but and like it's just not, it shouldn't be a big deal. It's just taking care of yourself, and there shouldn't be any shame in doing so, because you only get one body, and you have to take care of it as best as you can. I mean, are there any other topics, do you think? I mean, what comes to mind when you think of this stuff?
For me, it's definitely the huge gender divide, which we've already kind of touched upon.
Yeah.
But I really like what we've started to do where we have split genders. I know we try to make things inclusive for everybody, but it can just be uncomfortable when you're, I don't know, 3 females with 20 males talking about sex education. And I noticed at our school, what we've done is we've kind of separated rooms, and you talk about your own individual problems, and you feel a little bit more comfortable when feel like, yeah, I relate to that, or that's definitely happened to me. And I feel like that gives a girl, like that gives, especially being a girl, it gives us yeah, I know they did that to me too, they shouldn't be able to do that, right? Like it gives you some kind of
leverage almost, or more confidence to speak out about those things.
Yeah, it makes you feel a little more comfortable and less singled out.
Yeah. And I remember in OWL, when we would talk, we had our lock-ins, we would do these times where we'd split off into boys and girls. And I know that's kind of changed with the just more inclusivity with people who are not necessarily cisgender, they're non-binary. And that is a bit of a tricky thing to navigate with, especially with ab only. Like there's really no inclusivity for people who aren't male or female, and talking about those kinds of things just it is a challenge to navigate, and it's something that is changing every single day. But I do agree that when we were able to talk to like a female teacher, that like as someone who does identify as a female, it was really nice to be able to talk to other girls and like kind of relate experiences where it's like that wasn't really the right thing that should have happened, and that kind of really made me uncomfortable. And I'm not crazy for thinking that, and I'm not some prude for thinking
Yes,
that. Like,
exactly. It kind of helps shift the responsibility off the girls, because I mean, as a girl with, it seems to be guys are always advancing moves and you're always deflecting them, or but then you're called a prude, but if you accept them you're called slurs and stuff like that.
yeah,
It's nice to be in a setting where they're like, same thing happened to me, it's not your fault, or almost teaming up as victims united, rather than, I don't know, if I messed up in that situation, it's all my fault, I'm responsible.
yeah,
There's maybe a place for both. I think we did in my OWL class, we did always split off genders when we talked specifically about puberty and different physiological body things. The last class I taught, we stayed in one group because we have realized that even asking someone to define themselves in a binary gender is uncomfortable for some people. And so we've ended up doing that as one big group. I think in the context of OWL, it works because we have a group that spends pretty much a school year together, builds trust with each other. There's a lot of group building and trust building as we go through the class. And it's a little bit easier maybe in that situation to do a mixed gender kind of thing. I can see where that might be difficult in a classroom where you don't have trust with people and it feels awkward. The good thing about a mixed group talking about sexuality, whether it's the physiological things or the other, is that if you can learn to talk about those things comfortably, that translates into being able to talk to a partner.
yeah.
If you're comfortable enough to talk, you can talk to a partner. The last time I taught it, we have an APL class, and the last time I taught that, there was an exercise where boys were supposed to go off into a corner, girls were supposed to go off into a corner, make a list of questions you have for the other gender on a piece of paper and bring them back to the group, switch papers, go off and answer the questions. And the point of that is to try and not put anyone on the spot that wants to ask a question. And as I explained how this was going to work, my class, who had been through the middle school class and was now in the AP class, looked at me like I was crazy and said, why don't we just ask each other? And I thought that was awesome that they had become comfortable enough that in a mixed group, they could just ask their questions. And they did. They asked all kinds of questions where they had curiosity about the other gender's body and how it worked. And that was really good. Those skills can translate into being able to talk to a partner, and they can also translate into being able to talk to a medical professional, which is sometimes necessary. But if you can become comfortable talking about those things, I think that's nothing but good.
Yeah, that kind of, I was just about to lead into, I was going to ask the question personally to you guys, like, what are some ways that you think would help to reduce stigma around these topics? And that was perfect. I know, like just going through OWL, everyone felt like my friend, and I felt like I was able to like openly talk about those kinds of things with people. I think just having a good resource with like someone who's educated, like you, Sunny, like you're great to go talk to about those kinds of things. I know everyone doesn't have a Sunny to go talk to, but I mean, just like you said, having an open line of communication with your health professional and being able to talk about problems, or not problems, but things that are confusing to you, to your health provider. There's no judgment in that scene, like genuinely. And there's no shame in taking care of yourself and staying healthy. That's just kind of the basic human function. That's what we should all strive to do.
And your comment about the health department being a surprise in that they do encourage using condoms and they encourage testing and treatment for STIs. That's how medical professionals operate. They look at sexual health and want people to have the best sexual health that they can. It almost seems like in abstinence only, there's a feel to me of almost being punitive, that you shouldn't have sex, you shouldn't be sexually active. If you do that, you deserve whatever you get, whether that's an unintended pregnancy or an STI. That just has a punitive feel to me. Mm-hmm. But you do see that medical professionals are looking at this in a completely different way, and that's awesome.
Yeah, I remember when I was talking to Dr. Hartwell, she was saying, I never, ever deny any of my patients access to birth control. Like I would, that is completely against what my job is for. Like I want my patients to be healthy, and if I can't provide those resources to them and I deny those resources, I have no idea what they're going to resort to when they're desperate or when they don't know what else to do. Yeah, I mean, just being able to openly talk about these things. I mean, even when I tell people about my topic, at my job, someone asked me, "Oh, what's your senior project?" And I told her, "Oh, I'm talking about sex ed for a podcast with a bunch of different resources in my community." And they're like, they're like, "Wow, that must be challenging. Like, how did you find a mentor for that?" And I know, I was just kind of like, oh, owl. But even adults, like for them, like it's not, they're still kind of like hidey-tidy about it. Like people don't, it's just not it's not a common thing to be able to openly talk to someone about sex in our society. And I think it is getting better, but at this point in time, it's just not there yet.
No,
but I think the increase in comprehensive programs across the country and the introduction to that, in Southern Indiana, having an OWL program is a huge step. It's crazy. I learned more than I thought I would ever learn in OWL, but that an increase in information to people, just an overall better knowledge of these topics, I think will help to reduce stigma and stereotypes that aren't fair to people.
I think teaching, we did some workshops on values in our class, and by that we discussed all values, which are respect, responsibility, and relationships. We did a whole exercise in looking at encouraging each person to look at their own personal values, their family's values. And teaching values in that way, I think, is really valuable. Sometimes I feel that abstinence only is about value judgments and telling teens, this is bad, this is dangerous, this is shameful. That's someone else putting their value judgments on you. And I think when teens are taught facts and decision-making skills, they make good choices. They make better choices than teens that are uninformed. but that's been proven pretty regularly in several, well, a lot of studies.
Yeah.
But the more information teens have, the better choices they make, the healthier choices they make.
Erin, how have you, like, I know you were raised in a pretty strict household on that kind of stuff. How do you think you've been able to come into your own and be more open about that kind of stuff?
Honestly, a lot of it wasn't through school. It was mostly through my friends and listening to them talk about their encounters or their experiences. Having two older brothers really was a little scary because they do have that typical male view of like, I'm such a player, talked to like 3 girls tonight. So that one was a little rough. And then a lot of it was just my own initiative to kind of look at things myself and do a lot of research, kind of find out different resources and what options are available, how I feel about different things, stuff like that.
Yeah, that's good. Yeah, I just, I know my parents are very open about that kind of stuff, just from a pretty young age, just talking about that stuff. But I just know a lot of my friends didn't have that same experience. So sex is a daunting topic to talk about, but it shouldn't necessarily be when you're with someone, when you're talking about it with people who you trust and people who have your best interests in mind. But
and when that doesn't happen and someone isn't taught information, I mean, people are curious.
yeah.
Teens are curious, preteens are curious, everybody is curious about sex. If they aren't taught anything at all except don't have it, they look for other ways to satisfy their curiosity. And anymore, we're seeing a lot of easily accessible pornography that's taking the place of sex education.
Oh yeah.
It's so easy to find that anymore. And that's not teaching medically accurate information. You certainly don't learn about healthy sexual relationships from pornography. And they're saying now that the average age for boys to find porn and watch it is 11. And I think girls were maybe a year or two older.
Wow.
But when you have 11-year-old boys in your society thinking that they have learned something real about sex from watching porn, that's going to mess up them. That's going to mess up their partners. It's just a recipe for disaster.
Yeah.
But they believe it.
Yeah, porn, the whole discussion about porn is a whole separate monster of its own, pretty much. But, it's just the classic female woman's just kind of goes along with it, and the man just does what he wants to do, and the woman just has to kind of take it and go along with it and not protest or anything. It definitely, like you said, does not teach a healthy relationship. It doesn't teach any way about having sex. You never ever see porn with condoms, or even like just human error is just it's so present in daily life.
And it takes
out, don't see it with consent either.
Yeah, that too.
It takes away a ton of communication, especially one with the consent factor, two with the idea that you're talking about, Matilda, with it's usually the guy who gets everything, the woman is faking it, and there's zero talk unless it's kind of violent, and there's a lot of hitting, and I think it opens up a weird communication issue, especially in social situations for preteens, or even later developing on, when maybe those preteen boys don't know how to talk to girls or don't know how to treat girls specifically in that aspect.
Yeah. I remember looking at the OWL book, and I remember one of the topics was pornography, and we were all like, what? Like, we're gonna talk about that stuff? Like that's something people talk about? And it was really, eye-opening to hear like that's not how it works. It's not that's not real sex. It's not a real relationship that you have with a person. It's just not reality. But I don't know. Is there anything else that anyone would like to add?
Sunny, this is a little off topic, but I thought about it earlier and just never got a chance to ask. What is your input mostly on sex education and like judgment stigmas about like when is the right time to go see a gynecologist, or for guys to go get a prostate checkup? Because a lot of the time the stigma is once you're sexually active you should go, when in reality it should be once you're hitting puberty you should go.
In terms of, for example, STIs and maybe also contraception, you should go for an exam if you're sexually active. Because if you're sexually active, you are at risk for an STI, depending on, your level of risk, of course, can vary, but you're at risk. And so really you should be getting a somewhat regular checkup for STIs once you're sexually active, maybe once a year. You should for sure do that. I don't think that, and I'm really not very up on prostates. I don't think that's an issue for younger guys until
Yeah,
they become
it's
adults.
usually older. Yeah.
That's something that they tend to start checking when you're like a completely adult type person. I don't know whether that means, I don't know whether that means 25, 35, 45, 55, but that isn't something that they generally address with teenagers.
Yeah.
But either, any gender that's sexually active should have STI tests at the very least.
I know Dr. Hale was telling me about, there was people who were asking last episode, they had sent in questions about when the right time to go see a gynecologist was. And I know they mentioned that they're recommending pap smears for people with vaginas as young as 21 for pap smears. But they also said general STI testing should be whenever you are whenever you are sexually active, and if you ever switch partners, or whenever you do switch partners, it's important to go get tested and have your partner tested as well. And just that open line of communication, once again, is vital for keeping everybody safe in a relationship.
Yeah. We have actually always brought a doctor in to talk about contraception and STIs in our class. And, we could probably do that ourselves. But the advantage to that is not only can they answer questions like, what does that feel like when you get that done or whatever, it gives teens their first experience in having a discussion about sexual health with a medical professional who will not judge them. And it's like a practice run. It's like, okay, I've done this now. I've talked about sexual health with a doctor and survived it. So, that wouldn't be a terrible idea for people to experience as well. Yeah. But yeah, anyone sexually active should be tested on a regular basis, should start being tested at least once, just to be safe.
And I know even if you don't go to your health clinic, if you talk to your healthcare provider, you can ask to have a general STI panel done. And I think even if it's run on your parents' insurance, it'll just come up as labs. And Dr. Hartwell was saying, every time a parent asks me about that, I say she either tells them it's general lab testing for a blood test, or she says it's a urinalysis for any sort of healthcare or health issue. So it's not, you're not going to get outed if you go ask your doctor, general healthcare provider for an STI test, even if it's on your insurance, most likely, usually. But yeah, I guess just to cap it off, I think a general positive approach to sexuality and talking about it as something, a normal thing, because it is something that everybody deals with, but we're all so secretive about it. And no one should be ashamed to get help or ask for help and get resources from people that they trust. And it's just a way to stay healthy in all aspects of life. But I guess that's all I have. Is there any other questions or any other inputs anyone else has?
I think the podcast idea is awesome. And for those who haven't maybe had an opportunity to learn more at school or at home, this is certainly giving them a way to find out some more things that they wouldn't.
Thank you.
Great project, Matilda.
Thank you. Erin, anything from you?
I don't think so.
Oh, great. Thank you so much for watching my full podcast series. Of course, if you have any other questions, feel free to check out the resources I put in the description box. And thank you so much for supporting my senior project.